When I first received my lupus diagnosis, I was devastated. My family and I had never heard of lupus before, nor did we know of anyone in my family who had ever experienced this. We were having to navigate this by ourselves, especially since we had to drive from Tifton, Georgia to Augusta for me to receive treatment. I was young and often homebound due to frequent hospitalizations and multiple lupus flares. At that time, we didn't have a community or know of a lupus support system that existed. We eventually, over time, through networking and advocacy, connected with other lupus warriors and built a community slowly, but not right away. Navigating something so young, it was like I seen my life pass me by. I would see other students and friends being able to live normal childhood experiences while I had to be in hospital rooms or stay in the hospital beds. So it was tough to navigate this. When I turned 18, I was forced off Medicaid and had to navigate the insurance system on my own. Coming from a low-income family, I could not rely on my family's income to receive insurance, so I had to fight for every piece of coverage. This was hard for me, especially because I wasn't able to get the consistent treatment that I needed. This left me with several lupus flares, and eventually, after months of fighting, my healthcare team finally got my infusions reapproved. Patients should not have to deal with these unnecessary denials or delays to treatment. If I was to talk to a policymaker, I would want them to know that each chronic illness is not the same. We battle different struggles every day. Some days are bright, some days are dark and isolating. We can suffer from fatigue, pain, depression, and sometimes feeling like we're being a burden to others while all trying to live a normal life. At one appointment for my infusion treatment, I was getting checked in, and the advisor told me that I could not receive my treatment unless I paid thousands of dollars. I was in college at the time with no Medicaid coverage and did not have any insurance at the time. Unfortunately, I wasn't able to receive treatment, and that choice impacted my health. I began to develop several flares because I was not able to receive my infusion that month or the month following. No one with a lifelong illness should ever have to choose between their health and financial survival. I'm sharing my story so that no other teenager has to go through what I went through as a newly diagnosed teenager from South Georgia with limited access to care. At just 12 years old, I was diagnosed with lupus. And now, more than a decade later, I have recently graduated from medical school, and I am preparing to match into a pediatric residency program with the hopes of one day becoming a pediatric rheumatologist. 12-year-old me could never picture being where I am today, especially going to become a pediatric rheumatologist, one that I once needed, one that I once wished that I had in my community.